Hello and welcome everyone. Today our topic of discussion is appendix. In this video, we are going to discuss about introductory aspects of appendix like anatomy, positions and mesoappendix, histology of normal appendix and pathology affecting appendix. Appendix is located in the right pelvic region. The vermiform appendix is a tubular structure attached to base of cecum. It is vestigial organ. It is approximately 8 to 10 cm long in adults and it represents the underdeveloped distal end of the large cecum seen in other animals. Mainly 5 positions seen in the appendix. The most common position is retrocecal and retrocolic consisting of 75%. The second most common is subcecal and the pelvic position, and the rare positions are pre-ileal and post-ileal. The appendix is connected to mesentery in the lower region of ileum by a short region of mesocolon known as mesoappendix. Now let's understand the normal histology of appendix. The first layer is mucosa. The second is submucosa with prominent lymphoid tissue consisting of lymphoid follicles. Third is inner circular muscular layer. Fourth is outer longitudinal muscular layer, and last is serosa. The pathology affecting appendicitis are inflammation, infections and tumors. In inflammation, there are acute, chronic and xanthogranulomatous inflammations are seen. In infections, there are acute bacterial, granulomatous, viral, fungal and parasitic infections are observed. The tumors, benign tumors are polyp, mucocele and adenoma are observed in the appendix. And malignant tumors observed are adenocarcinoma, goblet cell adenocarcinoma, signet cell adenocarcinoma, mucinous neoplasm and neuroendocrine tumor or carcinoma. Let's understand acute appendicitis. The most common cause of acute appendicitis is obstruction of appendiceal orifice or lumen and secondary bacterial infection. Most common symptoms is periumbilical pain radiating to right lower quadrant. Other symptoms are vomiting, fever, bloating, loss of appetite, diarrhea. Complications of acute appendicitis includes mural necrosis and perforation and local abscess formation and peritonitis. Now let's understand the signs of acute appendicitis. First is rebound tenderness and percussion pain with guarding at McBurney point. The second is rousing sign. The palpation in left lower quadrant leads to pain in right lower quadrant. Third is psoas sign. Right hip extension lead to right iliac fossa pain. And fourth is obturator sign. The internal rotation of right hip leads to pain. We are going to discuss grossing of appendix in the another video. Now we focus on the histopathology. The common histopathology finding includes acute inflammation with predominance of neutrophils in all 4 layers of appendiceal wall. Different type of lesions are observed under the microscope and they are acute focal, acute suppurative, gangrenous and perforative inflammation. The early lesions consisting of mucosal erosion and crypt abscess, and later the inflammation in all 4 layers and necrosis are observed. Second is granulomatous appendicitis. In extrapulmonary tuberculosis, typical caseating granuloma with AFB positive bacteria can be identified. The other infections leads to granulomatous appendicitis are Yersinia and pinworm. The lesions like foreign body reactions and sarcoidosis are also associated with granulomatous appendicitis. Third is xanthogranulomatous inflammation. It is characterized histologically by collection of lipid-laden macrophages admixed with lymphocyte, plasma cells, neutrophil and often multinucleated giant cells with or without cholesterol clefts. These are the cholesterol clefts. Fourth is parasitic infection. Most common parasitic infections occur is enterobius vermicularis. In addition, parasites such as Entamoeba histolytica, Schistosomia, Tinea, Ascaris lumbricoides and very rarely Balantidium coli also has been reported in appendix. Fifth is benign tumors. Polyp. Polyp with bands of muscularis mucosae bundle with arborizing architecture and variable amount of inspissated mucin are found in polyp. Adenoma. Adenomatous changes at the crypt base with abundant mucin, which is characterized of appendiceal cyst adenoma. Sixth is malignant tumor, adenocarcinoma. The columnar and mucin producing atypical cell that form a ductal structures are observed in adenocarcinoma. Neuroendocrine tumor. Neuroendocrine tumors account over 50% of appendix neoplasms. They are cyanotomycin and chromogranin A positive. So this is in short about appendix, and these are the references for this video. Hope you like it. Thank you. Bye.